right now. Dr. Rajeev, since we did discuss that, young women or middle-aged women have a higher tendency of getting this illness, can we discuss pregnancy, which is obviously that's the age for pregnancy. So, what are the pregnancy options for patients with PH?
That's most important aspect rather in a childbearing woman who's having pulmonary hypertension. It is important because from the starting days when the mortality was very high in the tune of around 50%, though with the advancement in the medical science, it has reduced to the level of around 10%. But despite it, there are numerous maternal and the fetal issues which basically propel that we should avoid pregnancy. The lady should avoid pregnancy when she is having this pulmonary hypertension. The reason is that she can have increased this refractory hypertension. She can land up into pulmonary hypertensive crisis, volume depletion, preeclampsia, and that can lead to IUGR, prematurity, perinatal mortality. There could be increased mortality in the children, increased risk of congenital heart disease, and increased mortality and morbidity in female, that is the mother. And the reason, because of this is a very, particularly disease, as Dr. Arnachalam and Dr. Rahul and Dr. Rajat has very beautifully elucidated, this is basically a multifactorial. There are numerous causes are there, numerous implications are there, numerous pathogenetic mechanisms are there, which act at the level of pulmonary vasculature, which increases the pulmonary vascular resistance, the increase in the pulmonary artery pressure, and that's why there's an affection in the left heart pressure as well. And so there's a decrease in the left ventricular output, leading to, if you, for example, as Dr. Rahul was saying, that when you use the diuretics to just prevent this pulmonary congestion and to relieve edema in these patients, if you do some sort of over-diuresis, there's a volume depletion, that patient can have this pulmonary hypertensive crisis. So a lot more complications can occur, and that's why pregnancy is not advisable in these patients who are having pulmonary hypertension. And we should, particularly the baseline risk factors in these ladies are also should be assessed at that time. If some other way, if the pregnancy occurs, then a multidisciplinary approach should be instituted, and where you involve a cardiologist, a gynecologist, intensivist, a pulmonologist at the same time. So as to, you have to ensure, because most of the complications which occur, they occur during the first week of the postpartum. It can occur during the delivery time. It can occur during any time rather, because of, and that's why it is very, very important. You have to choose your appropriate drug. For example, the certain drugs are very readily contraindicated in these patients. As Dr. Rahul said, this newer drugs such as this gonal cyclase stimulators and various other drugs. And that's why it should be very properly tuned so that both the mother and the baby can be saved. So that's why, since the mortality is very high, so the only thing is to avoid it. And the means that can be used is that it can be very sort of contraceptions, methods of contraception could be used in form of vasectomy of the male partner, or female sterilization, or long acting, this reversible contraceptive methods, devices could be used.